Welcome to North Valley Plastic Surgery. My name is Stephen Gitt. I'm a dually trained and dually board certified plastic surgeon. I trained, of course, in both general surgery and plastic surgery, got board certified in both, and subsequently 10 years later recertified in both. I'm going to talk a little bit about cosmetic and reconstructive surgery after massive weight loss. That is indeed a passion and an interest of mine. Over the last 10 years, my practice has become increasingly focused on that particular subgroup of patients and that particularly unique subspecialty. And yes, the surgical care and management of massive weight loss patients is a very unique subspecialty within plastic surgery. Once you've made that extraordinary accomplishment of losing massive or substantial amounts of weight, which 95+% of the time will be the result of having had weight loss surgery such as a lap band or a gastric bypass, but in some patients is the result of diligent and vigorous diet and exercise. Either way, you are a very unique and special person, not only for your accomplishments, but for what you are and who you are. The residual effects of having had that much extra weight on your body are not so easily overcome as in just losing the weight. Once your tissues have been that stretched out and had to bear that burden of all that extra weight, they're forever changed. The elasticity, the blood flow, the healing potential of your skin, the quality of the structure of your skin and soft tissues are all affected adversely by having been large. And certainly that doesn't mean that you're not a candidate for cosmetic or reconstructive surgical procedures as needed. Rather, what that means is that the surgeon who takes care of you should really be well versed in the care and management of massive weight loss patients. Massive weight loss patients are special. Their tissues can't quite tolerate the degree of tension, the more aggressive surgical techniques that we can get away with on people who've never been large. If I were to apply the exact same principles on all of my weight loss patients, we would have a tremendously high incidence of horrible complications. The fact is, I don't and we don't. We take particularly special care of our weight loss patients. The average weight loss patient who comes through to see us here at North Valley Plastic Surgery is most interested in doing something about their midsection as a first procedure. Whether it's a tummy tuck, where you operate from hip bone to hip bone, taking out the extra skin and fat, tightening up the belly, relocating the umbilicus, and pulling up the pubis and the genitalia to a normal position. Whether it's an extended tummy tuck, where you carry that around to the posterior hip and suck out and lift up the lateral thigh areas, or a full body lift, where you go totally around the body and lift up the buttocks as well. We are well rehearsed, well practiced, and perform those procedures regularly. In fact, Dr. Heffel and I will usually double team those larger body lift type surgical procedures, and that offers an enhanced degree of safety for our patients. Blood loss tends to be less, surgical time and anesthesia time tends to be less, and our surgical efficiency tends to be much greater. That is a service that we are able to offer our patients here at North Valley Plastic Surgery because we have 4 trained plastic surgeons. Other issues that our weight loss patients will come see us about are very commonly excess skin of the arms, the bat wing appearance, excess skin of the inner thighs, excess skin of the lower buttocks, of the chest and the breast area going around the back, droopy, involuted small breasts, because when you lose weight in the breast too, and you still have all that extra skin. Breast surgery in the weight loss patient is very unique. In many cases, I won't put in implants at the same time as I do a breast lift in a weight loss patient because the tissues just don't tolerate the extra tension of putting the implant in. In many cases, weight loss patients will have folds of skin that go all the way around to their back areas. Well, we'll take that skin off, or even in some cases, we'll elevate that skin up as a flap, or that skin and soft tissue up as a flap, take off the epidermis, the superficial skin, turn it around, and fold it into the breast to augment the breast volume, the so-called spiral autologous breast augmentation procedure. Many of our weight loss patients have flattening of the buttocks, and instead of getting rid of that skin and soft tissue in back, we'll turn that around and lay it into the curvature of the buttocks on the inside to increase the size, curvature, and normalize the proportion and angles of the buttocks. Many times folks will have an excessively wide apron of skin going around their belly all the way around, but a much narrower torso. In cases like that, we can remove a large fleur-de-lis segment, a vertical segment of skin, so we sort of corset the whole abdomen in, and normalize your appearance. Lots of our patients, many of our weight loss patients will have hernias of the abdominal wall because quite often the umbilicus hole that the umbilicus comes through will be dilated, or any other previous surgical incisions after weight loss will be so lax that you can develop hernias. Well, being a duly trained and board certified general surgeon, both myself and my 3 partners, as well as plastic surgeons, we're quite capable of repairing any hernia that might occur in your abdominal wall, whether it's a ventral hernia or an incisional hernia. Dr. Heffel still practices a bit of general surgery. He can even take care of inguinal or groin hernias at any time. Now, in terms of how many trips to the operating room do our patients expect, well, it's really up to you. The average weight loss patient, if they really want to go to full cosmetic and reconstructive potential, will get to the operating room anywhere from 3 to 5 times. Each time I take one of my weight loss patients back to the operating room, I'm keeping in mind those procedures that I've previously done. Because if I'm able to make you look better about the body lift that I did 4 months ago when I have in the operating room for your breasts or your inner thighs, I'm going to do minor touch-ups and revisions, nips and tucks as needed. Because ultimately, every trip to the operating room is another opportunity to improve the outcomes that we've previously achieved. If any revisions are necessary, we also take that time and that opportunity to perform them at the same setting. Our goal is to get you where you want to be in the safest, most effective, and hopefully the lowest cost manner. We do accept almost all forms of insurance, and our philosophy is very simple. If insurance can be billed and insurance will cover the procedure, we're going to help you get that done, because ultimately that's what you pay your premiums for, and it is in your best interest. Thank you very much. I'm Dr. Stephen Gitt, wishing you a good day.